This is the Coronavirus Daily Briefing for Monday, March 9th, 2020. I'm Brian McCullough. Israel announces a blanket quarantine for anyone entering the country. A U.S. senator and representative are voluntarily going into isolation. Is Iran what it looks like when the virus spreads out of control? Is Italy's healthcare system on the verge of collapse? And running the numbers on what it would take to push the U.S. healthcare system over the edge. At the time of this writing, at least 545 cases of COVID-19 have officially been reported in the U.S. 230 new cases were added over the weekend. Puerto Rico has announced its first official case. California, New York, Oregon, and Washington State have all declared emergencies. Quoting the New York Times, U.S. officials are not yet talking about locking down whole cities, as China and Italy have done, but the specter of isolation, telling people in affected areas not to go out, is hovering in affected communities. Quote, I don't think you want to have folks shutting down cities like in northern Italy. We are not at that level. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said in an interview, quote, social distancing like in Seattle is the way to go, end quote. Officials in Washington, D.C. this morning urged hundreds of congregants who attended Christ Church Georgetown in recent days to self-quarantine because the church rector, Reverend Timothy Cole, has become the first known coronavirus patient in the District of Columbia. D.C.'s mayor said residents who attended the church on February 24th or between February 28th and March 3rd should self-quarantine for 14 days since the last time they attended the church. According to Sam Sweeney at ABC News, the rector shook hands with more than 500 worshipers last week and on February 24th. The church is canceling services for the first time since the 1800s, quoting the Washington Post. The mayor added that she is weighing declaring a public emergency in D.C., which would give her the power to impose quarantines, end quote. Late this morning, New York Governor Andrew Cuomo announced that the head of the Port Authority, which runs New York and New Jersey's airports, bridges, tunnels, and ports, has contracted the coronavirus. Quoting the New York Post, Cuomo said he himself could have been in contact with infected Port Authority Executive Director Rick Cotton, but hasn't been tested because he's an improbable positive, meaning he isn't likely to have the virus. Cotton is now quarantined, the governor told reporters, end quote. Cuomo also announced the total cases in New York State are now 142, 37 more than yesterday. Israel just announced that anyone entering the country will need to self-quarantine for 14 days. The total number of confirmed cases in Italy overnight rose from 7,375 to 9,172. So that is 1,797 new cases and 97 new deaths in just the last 24-hour period. The death toll in Spain reached 25 over the weekend, quoting the Washington Post. Spanish health authorities refrained from voicing alarm, however, as all the deaths from COVID-19, the disease caused by coronavirus, had by Sunday occurred among elderly patients, a population known to be especially vulnerable, end quote. Spain has reported more than 900 cases. Germany has reported more than 1,100 cases. 2 French lawmakers have tested positive, and 2 employees of the French National Assembly have. 71-year-old Portuguese President Marcelo Rebelo de Sousa said he was self-isolating himself after it was learned he had been visited by students from a school, which later reported a positive coronavirus case. Reports are coming from Italy that, angered by COVID-19 restrictions, at least 20 inmates escaped from a prison in Foggia. I've seen reports that the number is actually as high as 50, and the Italian army has deployed tanks in the streets of the city to catch the escaped inmates. And if anything will make you go, whoa, all of Ireland's St. Patrick's Day parades have been canceled. Quick follow-up on the situation regarding Seattle. There seems to be some evidence that the outbreak in Seattle is related to the outbreak on the Grand Princess cruise ship, but also the nascent outbreak in California as well, possibly. This comes from Trevor Bedford, a scientist at the Fred Hutchinson Cancer Research Center, who says he studies viruses, evolution, and immunity. At TRVRB on Twitter, link to the thread I'm drawing from in the show notes. Bedford says using genomic data to make connections between outbreaks, scientists at the University of Washington Virology Department and the Seattle Flu Study think that all the cases studied in Washington state so far are closely related genetically, quoting Bedford. Given this shared ancestry pattern, it looks like the large majority of current cases in Washington derive from a single introduction event, end quote. Bedford theorizes that this initial case was introduced to Washington state in mid-January. Then he points to work from the University of San Francisco and the California Public Health Department, which both suggest that phylogenetic analysis shows that the cases studied thus far from the Grand Princess cruise ship clusters are similar to the outbreak circulating in Washington state, quoting Bedford. The virus, CACDPHUC1, appears to nest within genetic diversity of the Washington state outbreak. This suggests a scenario in which an individual infected in Washington traveled to California/Grand Princess and instigated a chain of transmission that led to this case, end quote. Bedford stresses, quote, please keep in mind this is only a hypothesis and not proven fact, end quote. And one of the California scientists retweeted by Bedford tweeted this, quote, please note that this finding does not prove that the virus was transmitted from Washington state to California or vice versa. There are other scenarios possible, such as separate introductions from outside of the U.S. that are compatible with the phylogenetic grouping, end quote. Still, it's interesting and points a picture to why testing as many folks as possible is so important so we can get people infected into quarantine, because even one exposure could potentially cascade to so many. Speaking of Seattle and testing, remember yesterday when we discussed the Herculean testing efforts in South Korea, we mentioned that the country had instituted drive-through coronavirus testing labs. Well, it looks like Seattle is considering implementing something similar. Employees of the University of Washington's UW Medicine system can now get tested in a hospital garage capable of testing every 5 minutes, quoting NPR. Because of the way this virus could be spread, we want to make sure there's good ventilation, says Dr. Seth Cohen, who runs the infectious disease clinic at UW Medical Center Northwest. On the clinic's first morning of operation, a cold breeze was blowing through the structure. Cohen described it as, quote, excellent airflow that you can feel, end quote. When workers first drive in, they're greeted by Jan Nakahara, a nurse who usually works at the university's Hull Health Center. I'm going to have you pull up, she tells the driver, don't get out of your car. In The Atlantic magazine, Graham Wood has done the math and speculates that Iran may have more than 250 times the cases of coronavirus that they are reporting. Iran claims 7,161 COVID-19 cases, but Wood says Iran could easily add a few zeros to that. Wood calculated and estimated Iran's potential true COVID-19 cases in 7 different ways. So break out your pocket calculators and check out the Atlantic piece in the show notes to check his math. Quoting from the piece, when the final history of the coronavirus epidemic of 2020 is written, it may go something like this. The disease started in China, but it became finally and irrevocably uncontained in Iran. Knowing that the Iranian number is much higher than currently disclosed tells the rest of the world that the epidemic is even further along than official statistics indicate, end quote. At the end of the piece, he concluded this, quote, the average of these estimates is about 2 million cases, which is about 250 times the official number and 15 times the total cases acknowledged worldwide. According to models, the point prevalence of COVID-19 in Canada, as an example, could rise to 5 to 10% of the total population when the epidemic reaches its peak. These numbers, which I have shown to experts, suggest that Iran may be at or near that point right now. Does Iran really have 2 million citizens with COVID-19? Perhaps politicians spend more time in public and are therefore more susceptible to infection. If so, some of the estimates above would overstate the number of cases. Then again, it's also possible that they were aware of the epidemic earlier and took precautions. In that case, those estimates would understate the number of cases, end quote. On Twitter, Wood later said, quote, the real numbers are apocalyptically bad. A mature COVID-19 epidemic that totally swamps Iran's ability to cope. If you want to see what happens when coronavirus burns through a country uncontrolled, look at Iran right now. This is what peak COVID-19 looks like. You might have seen the news that Senator Ted Cruz is going into voluntary isolation at his home because at the recent Conservative Political Action Conference, or CPAC, he apparently interacted with a person attending the conference who was subsequently tested positive for COVID-19. Cruz said he will remain in his home until a full 14 days have passed since his interaction with the individual. Representative Paul Gosar of Arizona similarly interacted with the person and is doing the same, quoting CNN. Given that the interaction was 10 days ago, that the average incubation period is 5 to 6 days, that the interaction was for less than a minute, and I have no current symptoms, the medical authorities have advised me that the odds of transmission from the other individual to me were extremely low, Cruz said in a statement. Gosar said in his own statement later Sunday that, along with 3 members of his staff, he was with the infected individual, quote, for an extended period of time, and we shook hands several times, end quote. He said he'll remain at home in Arizona for 14 days and that his office would be closed for the next week. NBC News is reporting that members of Congress are increasingly worried about coronavirus, with some members pressing leadership to potentially recess Congress for a number of weeks. Quote, members are very nervous, a senior Democratic leadership aide told NBC. There's a lot of concern that members could bring it home, end quote. And quoting from later in the NBC piece, quote, you cannot test everybody who comes in the front door of the Capitol. House Speaker Nancy Pelosi told reporters Thursday, it is unreasonable and probably in some ways not focused enough on what needs to be focused on, she said, adding that the office of the Capitol physician would be making the decisions on protocols. Congress as a whole could be more susceptible to dangerous symptoms of the coronavirus than the public in general. 66 senators are over 60, 2/3 of the body, with more than a quarter over 70. The average age of House members is 57.6 years, according to the Congressional Research Service, end quote. As just mentioned, we have already seen leadership in countries ranging from Iran to Italy to France contract the virus, so it is likely a matter of time before something similar happens here. And a quick follow-up on the situation in Italy. There's an interview with Alberto Mantovani, the Italian physician and immunologist who is among those coordinating the response to the crisis in Lombardy's intensive care units. It will require running the article through Google's Translate to read it for yourself, but even with imperfect translations, the situation seems dire. Link to the article in the show notes, of course. This is quoting Dr. Mantovani. The picture is of such gravity as to require an increase in resuscitation places up to 10 times the current availability. The number of hospitalized patients expected on March 26 is 18,000 Lombard patients, of which between 2,700 and 3,200 will require hospitalization in intensive care. Today, there are already over 1,000 patients between those in resuscitation and those who risk getting worse from 1 minute to the next. We monitor the situation 24 hours a day. By now, we are forced to create intensive therapies in the corridor, in the operating rooms, in the recovery rooms. We gutted entire hospital wards to make room for the seriously ill. One of the best healthcare systems in the world, the Lombard one, is one step away from collapse, end quote. By the way, based on those numbers and the known cases in Italy, it suggests that 1 in 6 cases in Lombardy don't just require hospitalization, they require intensive care. ICUs being set up in hallways, that's not good. If 1 in 6 patients require such intensive and round-the-clock intervention, there is unlikely to be any healthcare system in the world that can handle that. CNN reporter Jim Sciotto tweeted this morning, quote, according to estimates from the U.S. Department of Health and Human Services, even with a moderate outbreak, 200,000 people in the United States will need intensive care. The United States has less than 100,000 ICU beds, end quote. More about worries that the virus could end up breaking the U.S. healthcare system in the next segment. Over the weekend, a tweet storm from Liz Specht got a lot of attention online. Liz is the Associate Director of Science and Technology at the Good Food Institute. I'm going to read about half the tweets in this total tweet storm, but link to the original thread is in the show notes. Quote, I think most people aren't aware of the risk of systemic healthcare failure due to COVID-19 because they simply haven't run the numbers yet. Let's talk math. Let's conservatively assume that there are 2,000 current cases in the U.S. today, March 6th. This is about 8 times the number of confirmed lab-diagnosed cases. We know there is substantial underdiagnosis due to lack of test kits. I'll address the implications later of under-over estimates. We can expect that we'll continue to see a doubling of cases every 6 days. This is a typical doubling time across several epidemiological studies. Here, I mean actual cases. Confirmed cases may appear to rise faster in the short term due to new test kit rollouts. We're looking at about 1 million U.S. cases by the end of April, 2 million by around May 5th, 4 million by May 11th, and so on. Exponentials are hard to grasp, but this is how they go. As the healthcare system begins to saturate under this caseload, it will become increasingly hard to detect, track, and contain new transmission chains. In absence of extreme interventions, this is what happens. What does a caseload of this size mean for healthcare system? We'll examine just two factors: hospital beds and masks, among many, many other things that will be impacted. The U.S. has about 2.8 hospital beds per 1,000 people. With a population of 330 million, this is around 1 million beds. At any given time, 65% of those beds are already occupied. That leaves about 330,000 beds available nationwide. Perhaps a bit fewer this time of year with regular flu season, etc. Let's trust Italy's numbers and assume that about 10% of cases are serious enough to require hospitalization. Keep in mind that for many patients, hospitalization lasts for weeks. In other words, turnover will be very slow as beds fill with COVID-19 patients. By this estimate, by about May 8th, all open hospital beds in the U.S. will be filled. This says nothing, of course, about whether these beds are suitable for isolation of patients with a highly infectious virus. If we're wrong by a factor of 2 regarding the fraction of severe cases, that only changes the timeline of bed saturation by 6 days in either direction. If 20% of cases require hospitalization, we run out of beds by around May 2nd. If only 5% of cases require it, we can make it until May 14th. 2.5% gets us to May 20th. This, of course, assumes that there is no uptick in demand for beds from other non-COVID-19 causes, which seems like a dubious assumption. As the healthcare system becomes increasingly burdened, prescription shortages, people with chronic conditions that are normally well managed may find themselves slipping into severe states of medical distress, requiring intensive care and hospitalization. But let's ignore that for now. All right, so that's beds. Now masks. Feds say we have a national stockpile of 12 million N95 masks and 30 million surgical masks, which are not ideal but better than nothing. There are about 18 million healthcare workers in the U.S. Let's assume only 6 million healthcare workers are working on any given day. This is likely an underestimate, as most people work most days of the week, but again, I'm playing conservative at every turn. As COVID-19 cases saturate virtually every state and county, which seems likely to happen any day now, it will soon be irresponsible for all healthcare workers to not wear a mask. These healthcare workers would burn through N95 stockpile in 2 days if each healthcare worker only got 1 mask per day. 1 per day would be neither sanitary nor pragmatic, though this is indeed what we saw in Wuhan, with healthcare workers collapsing on their shift from dehydration because they were trying to avoid changing their PPE suits as they cannot be reused. How quickly could we ramp up production of new masks? Not very fast at all. The vast majority are manufactured overseas, almost all in China. Even when manufactured here in the U.S., the raw materials are predominantly from overseas. Again, predominantly from China. Keep in mind that all countries globally will be going through the exact same crises and shortages simultaneously. We can't force trade in our favor. Now consider how these two factors, bed and mask shortages, compound each other's severity. Full hospitals, plus few masks, plus healthcare workers running around between beds without proper PPE equals a very bad mix. Healthcare workers are already getting infected even with access to full PPE. In the face of PPE limitations this severe, it's only a matter of time. Healthcare workers will start dropping from the workforce for weeks at a time, leading to a shortage of healthcare workers that then further compounds both issues above. We could go on and on about thousands of factors, number of ventilators, or even simple things like saline drip bags. You see where this is going. Importantly, I cannot stress this enough. Even if I'm wrong, even very wrong about core assumptions like percentage of severe cases or current case numbers, it only changes the timeline by days or weeks. This is how exponential growth in an immunological naive population works, end quote. That, my friends, is what has a lot of people concerned. Not just, will I get the virus? Will my loved ones get it? Will it be severe? Not just death rates, not just infection rates, not just quarantines, not shortages, but the absolute potential breakdown and crippling of the entire healthcare system. Quick note on one other thing that you might have seen passed around this weekend that is related to this idea of capacity and the number of hospital beds that we have available to treat the virus. There have been screenshots and tweets going around purporting to show a slide attributed to the American Hospital Association's, quote, best guess epidemiology for COVID-19 over the next 2 months. And on that slide are the expected 4.8 million hospitalizations and 1.9 million ICU admissions. Please note that this screenshot of this slide is not from the American Hospital Association. You should not take those numbers as official estimates, at least not by anyone official. The following is the statement from the AHA on this matter. Quote, the AHA regularly hosts webinars and conference calls that include a variety of voices and opinions that seek to provide relevant information to professionals at hospitals and health systems that are on the front lines of preparing for and protecting their patients and communities. A spokeswoman for the AHA told Business Insider in an emailed statement, quote, the slides you shared reflect the various perspectives of field experts and should not be attributed to the AHA, end quote. Just like yesterday, I'm going to give you some quick additional notes on process for this show. Wherever possible, we will attempt to show our work. If you check the show notes every episode, we will make every effort to link to every story or tweet that we quote from. Also, I know a big part of the story today was the reaction of financial markets, and we might cover the economic fallout of this to some degree at some point in the future, but today I took a pass. The Coronavirus Daily Briefing has been produced by Ride Home Media. I've been Brian McCullough. Be well, everybody. Talk to you tomorrow.